Mapping exact ministerial responsibilities forces the government to answer for the execution and the consequences of their policies. The shield of organizational complexity is neutralized.
We can apply this mechanism directly to current threats. In 2025, NHS England is scheduled to be abolished and reintegrated into the Department of Health and Social Care. Centralizing power back into Whitehall carries severe constitutional risks. It concentrates massive financial power, drastically reduces independent operational oversight, and subjects clinical operations to immediate political pressure. Under a public governing record, an administrative move of this size triggers a mandatory constitutional impact assessment. This flowchart maps how inputs, like the transfer of statutory functions, feed directly into legally required outputs, generating strict duty holder maps and benefits realization frameworks. This assessment legally forces the executive to document precisely how it will prevent political conflicts of interest. Post-implementation, this framework is used to compare the original promises against the actual datasets generated by the reform. Governments must publicly and legally justify the constitutional impact of their restructuring. Shuffling organizational charts to escape blame will leave a permanent paper trail. The mechanism is also built to track the most covert erosion of the state's statutory duty, the rapid privatization of timely healthcare access. Employer-provided private medical insurance has experienced an explosive expansion. These corporate plans now cover a record 4.7 million high-paid and technical workers across the UK. This split-screen table illustrates the resulting class disparity. On the left, high-paid technical staff enjoy fast, comprehensive private coverage. On the right, essential non-technical workers, cleaners, porters, and care staff remain entirely reliant on failing NHS waiting lists, resulting in the poorest overall health outcomes. The public governing record forces Parliament to explicitly track this divergence. It measures exactly how state reliance on private schemes degrades the baseline standard for everyone else, and stamps a legal violation on the disparity. Allowing private insurance to replace public capacity without a documented policy vote is an undocumented violation of the state's foundational public health duty. The ultimate lesson of the post-2012 NHS is that the illusion of structural reorganization must never again be confused with actual, enforceable legal accountability. The argument submitted to the Modernizing Elections inquiry identifies a critical requirement for public trust. Accountability should encompass the total conduct of government in office, ensuring that the use of state power remains as intelligible and answerable as the election that granted it. By implementing this mechanism, vague political promises are converted into a durable, traceable ledger of state action and liability. Until electoral law demands a permanent, structural record of governance, the public will be forced to continue funding their own systemic failure.